Patients with chronic heart and lung problems have a major health challenge for them. For example, for those who have heart failure, their heart's not pumping well, that they have to come in hospital quite frequently. In the emergency department, I see them come in very often.
People can be very stable with their heart failure for a number of days, weeks, and months, but then all of a sudden, out of the blue, something can change.
Statistics suggest that 1 in 4 of them have to return to emergency department and readmitted within 1 month, and 4 in 10 need to be readmitted within 3 months. That's huge in terms of the quality of life, in terms of how a patient's be able to manage their life, thinking about going travel or living healthily or even living well at home.
When I came back from hospital the last time, I was quite scared of going out. Me, who's never been scared of anything.
And so our project, Tech for Home, is really to try to figure out how can we support our patients with heart and lung problems so that they can live healthy at home when they get discharged from hospital. We need to make sure that our health professionals partner with our patients to help them to monitor the disease well. Secondly, we need the patient to do self-management with good knowledge and good information to help themselves well. For example, we provide them with a clip on the finger so that we can measure the amount of oxygen in the blood and also the heart rate. We also provide them with a blood pressure cuff so they can measure their own blood pressure. And we provide them with a scale so they can step on the scale and know their daily weights. We also provide them with a tablet so that we can then ask them some questions. For example, do you feel short of breath today? Do you feel chest pain today? Do you feel good today?
When I log into my computer every day, I can actually see a list of all of my patients basically right in front of me, and I can actually, the system actually prioritizes the alerts that are coming in for my patients, so I can actually look and see, oh, Mrs. Smith is, has 5 alerts today, and I can see her weight and blood pressure and heart rate. This technology, the telehealth monitoring, actually gets patients into the habit of, putting in their weight and their blood pressure every day, answering these questions, so they get to learn what their symptoms are from a day-to-day basis. And what we want them to do is recognize any changes in their heart failure symptoms. And if they have changes, then we want them to report it early.
It's a bit onerous having to remember to get up and go and stand on the scales and do it all, but in other ways it's exciting because I'm watching my weight come down, hooray, and taking my blood pressure each day, which is steadying, which is amazing.
The result of phase 1 was very, very encouraging. In fact, we were able to significantly reduce the admission rates of these patients. And that's why we're going to go into the full clinical trial now, whereas phase 1 is only done in Vancouver with Kelowna, that in phase 2, we're going to expand it to 24 communities across the province.
I've been 3 times to the theatre since all this started, and I'm going again on Sunday. So I am a living proof of this works.
We're very excited that we can carry out this rigorous study of heart failure patients, so the largest in Canada that we're aware of, that compares those who use this home-based technology to those who don't at the same time, so that we can identify whether it will have the evidence for us to actually demonstrate what we shown in phase 1, significant reduction of hospital needing to come back to hospital, and also staying well at home.
Somebody else is looking after me. It's like a guardian angel.